For my poster presentation, I'll be talking about utilizing a mask-making intervention with active service members suffering from traumatic brain injuries and post-traumatic stress disorder. Hi, my name is Alexandra Zan Morris, and I'm currently getting my master's in counseling psychology with an emphasis in expressive arts therapy at the California Institute of Integral Studies. I'm also a certified clinical hypnotherapist. So for our introduction, let's first talk about the statistics. The military population acquires traumatic brain injuries through blasts, blast plus motor vehicle accidents alone, and gunshot wounds. And according to the Defense and Veterans Brain Injury Center, over the past 5 years, over 115,000 active service members have been diagnosed with traumatic brain injuries. It's estimated that approximately 30% of individuals who have been in war zones develop post-traumatic stress disorder. And unfortunately, many veterans and active service duty members avoid seeking psychological help due to the stigma. So what are the symptoms of traumatic brain injuries and PTSD? According to the Mayo Clinic, the symptoms of traumatic brain injury include cognitive issues such as amnesia, inability to speak or understand, or to create new memories. Behavioral issues include lack of restraint, aggression, being impulsive. There's even physical neurological issues with the body such as balance disorders, blackouts, dizziness, fainting, or fatigue. Mood symptoms can include anger, anxiety, apathy, or loneliness. There can also be gastrointestinal issues, dilated pupils, slurred speech, and even sensitivity to light. The symptoms of PTSD, post-traumatic stress disorder, include behavioral symptoms, agitation, hostility, hypervigilance, self-destructive behavior, psychological symptoms such as flashbacks, fear, severe anxiety, or mistrust, mood, loss of interest or pleasure in activities, guilt or loneliness. Sufferers may also suffer from insomnia or nightmares, as well as emotional detachment and unwanted thoughts. So in the year 2010, an art therapist named Melissa Walker began an art therapy program at the National Intrepid Center of Excellence at Walter Reed National Military Medical Center. She's been treating active duty service members from any branch of service, age, or rank during her 4-week program. This program has been going on for the past 6 years, and during this time she has done her mask-making intervention with over 600 service members. She decided that these service members suffering from TBIs and PTSD needed a therapeutic intervention that would help them process and express their trauma. The mask-making intervention. This image is of a mask that an active service member made, showing his extreme addiction to alcohol and the inner demons he faces from being a combat PTSD soldier. Now, according to Melissa Walker, this approach is therapeutic and effective because someone who has experienced trauma has a block that keeps them from verbalizing what they've been through. There's a shutdown in the broca, the part of the brain responsible for speech and language. The mask gives them a way to explain themselves. The concrete image of the mask unleashes words. It reintegrates the left and right hemispheres. Now they can discuss their feelings with their social worker or psychiatrist. Other benefits of this mask-making intervention include reduction of neurological arousal, reactivation of positive emotion, enhancement of emotional self-efficacy, reconsolidation of memories, improved self-esteem, improved fine motor skills, and reintegration of the left and right hemispheres of the brain. So how does this mask-making intervention work? It's really quite simple. The materials include a blank mask of paper mache, white gesso, acrylic paint, paint brushes, sculpting clay, waterproof marker pens, wool, various fabrics, scissors, and a glue gun. Basically, the service members had the freedom, the liberty to take a mask and really do whatever they wanted with it. The prompt for this mask-making activity was that it was an opportunity to make their inner emotional world visible. The client had the opportunity to go beyond the mask they showed to their family, friends, and fellow service members and express their inner wounds in a nonverbal way. The art therapist allows the group time to reflect on their mask and have them take notes, draw, or sketch out their respective mask. The art therapist orients the group with the various art supplies. Each individual is given a paper mache mask. They paint the mask with the white gesso, allow it to dry, and then paint with acrylic paints. Later, they have the ability to add on whatever else they'd like. In terms of further study, more research should be done to research the potential for utilizing mask-making interventions with service members and their families. There needs to be more qualitative studies of mask-making interventions during the process of the arts intervention and afterwards, and utilizing this intervention with veterans who have been out of service for 5 or more years. Here is my contact information and my various references. Thank you for your time.